Genetic test results. Positive results. A positive result indicates that a pathogenic or likely pathogenic variant has been identified in a cancer predisposition gene. You are a carrier of this variant. What does that mean? You have a higher risk of developing certain types of cancer. This may cause changes to your management, screening, and risk reduction plan. You will receive follow-up care that is adapted to your risk of developing cancer. Your family members are eligible for genetic testing. Your personal risk of developing cancer varies according to the identified gene. This gene is a predisposition, meaning that not all individuals carrying this pathogenic variant will develop cancer during their lifetime. Other risk factors such as age, lifestyle, and environment also contribute to the development of cancer. The results will help you understand why there are many cancers in your family. If you ever had a type of cancer that is associated with this gene, your result will also give you a better understanding of its cause. Negative results. True negative and inconclusive. True negative. When a pathogenic variant in a cancer predisposition gene has been identified in a family member, genetic testing can determine whether you carry or do not carry this familial variant. A negative result means that you did not inherit the familial variant. Your lifetime risk of developing cancer is the same as that of the general population. You do not need increased screening. You should follow the screening recommendations for the general population. Your children are not at risk of inheriting the known variant in your family. Inconclusive. A result is inconclusive when no mutation is known in your family and your analysis did not identify a pathogenic variant among the genes tested. Depending on your cancer diagnosis, or if you have a family history of cancer, this result does not entirely rule out the possibility of a hereditary predisposition to cancer. In such cases, remember, some mutations are still unknown. Depending on the genetic analysis, some of the known genes may not have been tested. Some genes are still unknown. It is possible that the family history of cancer is associated with risk factors other than genetics. Your risk is undetermined. A treatment and screening plan will be based on your personal risk factors and on your family history of cancer. Knowledge about hereditary cancer predisposition genes is constantly evolving, and additional testing options will likely be available in the near future. Variant of unknown significance. Your analysis has identified a genetic variant in a cancer predisposition gene for which the effect is unknown. Your risk is undetermined. A variant of unknown significance is different from a positive result. Current knowledge does not allow to determine whether this change is benign and without effect, or whether it is associated with a risk of developing cancer. What does this result mean? No change will be made to your treatment or screening plan. Your risk of cancer is based on your personal risk factors and family history of cancer. Genetic testing for this unknown variant is not recommended for other members of your family. In certain situations, to try to determine the significance of the variant, the laboratory may suggest genetic testing for specific members of your family. The different types of variants are categorized from neutral, in which case the variants have no clinical impact, to pathogenic, in which case the variants are associated with a genetic disease. A type of variant could change categories in light of new research data. Its impact could be upgraded or downgraded. Medical follow-up would then be modified according to what new knowledge reveals.